In this video, I shall talk about the difference between central retinal artery and central retinal vein occlusion. So let's start with the central retinal artery occlusion. We have to know that the central retinal artery is a branch from the ophthalmic artery, which is the first branch from the internal carotid artery. The central retinal artery passes through the optic nerve, and at the level of the ganglion cell layer of the retina, it divides into its branches, which is mainly the superior and inferior branch, each of which will supply its part of the retina without crossing the midline. Now let's talk about the first clinical scenario, which is occlusion of the central retinal artery. In this situation, there will be sudden, painless, almost total loss of vision in the affected eye because the central retinal artery is an end artery and frequently is occluded by an emboli. If you do a fundoscopic examination, you will find a pale retina with occasional cherry red spots which represent the area of the macula. Hence, this area is supplied by the cilioretinal artery, which is a branch from the short posterior ciliary arteries, and it is found in 15% of the people. Now, the second scenario is occlusion of a branch of the central retinal artery, like in this scenario, the superior branch. This will result into an inferior altitudinal visual field loss. Causes of the central retinal artery occlusion could be either arteritic, like inguinal arteritis, or non-arteritic, like atherosclerosis or systemic hypotension. Now let's talk about central retinal vein occlusion, which had the same clinical features as central retinal artery occlusion, with sudden, painless, unilateral loss of vision. However, if we do a fundoscopic examination, we will find an optic disc swelling and dilated and tortuous veins with widespread or diffuse retinal hemorrhage. Causes in this scenario can include diabetes, hypertension, and other blood disorders.